All right, to have your monitoring equipment appropriately set up, you want to go ahead and plug in the monitor, and then you want to pull all of these cords that are attached to it will come coiled with it. You want to go ahead and pull them out and have them ready so that once we need them, we're not trying to untangle stuff with an anesthetized patient. So a couple of these cords, the leads, they have this heavy piece right here. The pulse ox as well has this heavy piece. So what I've done is I've just draped them over the sink so that they're not dragging and pulling all of the stuff off of my patient. You just want to kind of critically think about where you want the cords to be. So I've put all of the cords underneath the bear hugger because when we go to clip and shave, or even when we go to push the patient on the table, we might need to move this bear hugger, and I don't want to move the bear hugger and then have all my cords go with it. So just kind of visualize the motion so you have a good idea on how you should arrange it. And then you don't have to clip these on any particular side. I've just clipped them all together, pulse ox and my 3 EKG leads. So they're right here ready to go. And then I've just coiled up my blood pressure cord right here. I've also picked out 2 cuffs. You want to at least get 2 of appropriate sizes. We do expect you to pick out sizes that match your patient. So I've picked out a number 2 and a number 3 cuff. These are found in surgery, and I can show you that in a little bit. So I've got my 2 blood pressure cuffs. I've also gone ahead and gotten out a square of gauze and a thermometer and the lube. So that's prepared for us to go ahead and take the patient's temperatures. Set myself up just a little side basket here with intubation supplies. So I've picked out an appropriate laryngoscope handle with blade. It snaps on like this, and then you push it back. You do want to make sure and check that you have a good light. I actually had to change the batteries on this one when I first pulled it out, so make sure it works. I've gotten myself some tie to tie the tube into the patient. Some dry gauze to grab the tongue. The tongue can be really slippery, especially when we've given them a bunch of drugs that are amping up the parasympathetic system. They get really drooly. So a nice piece of dry gauze will help you grab the tongue. And then some sterile lube for my tube. The tie and the sterile lube can be found right up here in the cabinet. There are different sizes of the tie, and there is also tie gauze. So whatever your instructor's preferences is fine. Go ahead and pull some of these out and find a size that's appropriate for your patient, because some of them are long and some of them are short. I then went and picked out a few tubes. We really just want to make sure that you have 3 tubes that seem like they may match up to the patient. If you're not entirely sure, sometimes they're too wiggly to truly palpate and measure to ensure you have the right size. So just eyeball it, or maybe while you're doing your physical exam, palpate the trachea a little bit and get yourself an idea on what size tubes you may want. So I picked a 6 as my primary one. So then I went ahead and picked out a 6.5 and a 5.5. You want to have one below and one above. I did have all 3 of them puffed up, and you'll notice they were in paper towel. These are going to go into the trachea, so I want to keep them clean and not dusty. So when I picked them out, I had puffed them all up with my cuff puffer that sits right here on the side of my anesthesia. You want to make sure you're always putting this back in here so we have it when needed. We're not searching for it. So I've already puffed these guys up, and what you'll do is you want to put enough pressure into it that it actually feels full. Otherwise, you won't be able to detect the leak. And you're going to squeeze down here to feel the fullness. This piece is mimicking the cuff on the actual tube. And you don't really have to twist, but you do have to push down in order to open up the line. So I filled it up. These are fairly small tubes, so they just took about 1 syringe. Larger tubes, you may want to put in a couple, but the goal is to get this a little taut, so that you can feel if it has leaked over time. As long as they sit for a minute, that's fine. These sat for a little longer than that, and that's okay too. When you are getting rid of the air, you want to really make sure you suck it completely out. You want this to look like a raisin. If it's still a little puffy, do this one. If I don't pull it all out and I leave it a little puffy like that, that's all going to be resistance in the trachea that can cause tracheal damage or just make it really difficult for me to place it. So again, this is your indicator of what that cuff looks like. So this definitely still has air in it. So I'm going to really suck every last little bit of air so it's nice and tight. I'm going to do this one as well, just to be sure. Okay. Once our patient has been pre-medded, and the catheter's been placed, that's a great time to actually measure the tube because one, the patient is more sedate, so they're going to be a little bit more handleable, and two, we've already placed our catheter. You don't want to upset and kind of stimulate your patient a lot before you've placed your catheter. You're going to lose the whole purpose of our pre-med to get them nice and tranquil for us. So I'm just going to sit these back over here, cover it up in their paper towel. So the next thing I'm going to show you is the fluids.